Good morning, everyone. My name is Chris Nugent. I'm delighted to be here and have the opportunity to speak. There's always one presentation in a session like this that people go, that doesn't really fit, and I fear I've got the short straw today. But I'm going to talk to you about some work we've been involved in the prevention of Alzheimer's disease through smartphone technology. And we called it Grey Matters, and it's in collaboration with some colleagues that we work with in the University of Utah in the US. So I just want to take 10 minutes and give you a very quick overview of what the technology was, what the results were from the study, and where it's really going to, and what we're working on at the minute. So I'm from this group in Ulster University, the Smart Environments Research Group. I lead this group. There's about 40 of us, and we're a mix of computer scientists, electronic engineers, multimedia designers, and health scientists. And we're very interested to look at what information we can record from environments through sensorized technologies and how we can then model and understand behaviour. And we're really agnostic to any type of environment. So we work at home, we work in the community, we work in schools, and we work at the level of cities. So that's our website and our Twitter if you want to find out any more information about our group. So I really liked Ardo's photograph of his back garden. I live in Ballyclare and I can't really show anything that competes with that. So the best thing I could find this morning was, this is a picture of my dog last Saturday morning. Last Saturday was really, really nice day. I have the craziest Labrador that exists, but for some reason she really likes to have her photograph taken. So if you do want any photographs of Labradors for any strange reason, just let me know. Okay, so Alzheimer's disease is a global health concern. It's one of the most, or it is the most common cause of dementia, and the typical symptoms are going to be ones of memory, confusion, mood changes, difficulty in communicating, difficulty in reasoning. So it's a very, very topical area, and we focus a lot of our work at Ulster University on how we can use technology to support people with Alzheimer's disease. Now, a lot of effort, as I'm sure everybody knows, has been directed towards pharmacological treatment of Alzheimer's. And while all of those efforts are being focused towards the development of a cure, there is an opportunity to step back and say, can we actually prevent the onset of whether it's Alzheimer's or indeed any health condition at all. So there has been a call to look for efforts to concentrate on addressing the modifiable risk factors associated with Alzheimer's disease. And that's what we've focused our work on, and that's what the Grey Matters study has considered. So if we look at this very, very simple pie chart here, so 1/3 of the risk factors associated with Alzheimer's disease are genetic. So that means there's nothing that we can do about that from a technology point of view. But if we look here, we can see 2/3 are non-genetic. And that's things like social, societal, environmental, educational, and behavioural factors. Okay, so the important point to note here is that non-genetic risk factors are modifiable. So our hypothesis is if we can focus on those risk factors that are modifiable, then there's a possibility for us to prevent whatever the condition might be. And in our case, and in this study, we focused on Alzheimer's disease. So when's the best time to intervene? Well, many people may know that Alzheimer's happens a long time before it actually becomes noticeable. So it can happen maybe 10, 15 years before the signs actually present. So in our study, we've looked at a cohort of middle-aged adults in the age range of 40 to 64, 65-year-olds. So our hypothesis here is if we can focus on this group, if we can modify these lifestyle factors, then we have a possibility to prevent the onset at a later stage in life of Alzheimer's. So we worked with a university in Utah in the US. The reason we worked with them, we had another project, and over lunch one day we just were talking about this idea, and it really came out of nowhere. We drove a lot of this work between the two universities in Utah and in Ulster, and we ran over a period of 6 months an RCT on 146 participants. So we had 100, just over 100 were given our app, and then we studied the other 42 without any intervention. And there was 3 things that we studied during this 6-month period. So we ran these intervention programs. So we had about 45 of these programs where we brought everybody in and we told them about the benefits of changing different lifestyle factors. The second thing that we did, and that's what our role was at Ulster University, was to look at the smartphone app and how we could aggregate all of the information, how we could provide some interaction. And the third point, we've heard a lot about this today, activity monitoring. So Nike gave us a philanthropic donation of 150 of their fuel bands. So we were able to give all of the participants a fuel band to record their activity levels throughout this 6-month period. So what I want to do is talk a little bit more about the app itself and then show you some of the results that what we found from this, I think, quite exciting study that we had the opportunity to engage in. So the actual app itself, it runs on iPhone or it runs on an Android, whatever your preference might be. 3 real components to it that we developed. One was this delivery of, we call them factoids. I don't think factoids is the right word to use, but it sounds quite cool whenever an American says factoid. So we stuck with this term, and really a factoid was 2 pieces of information where we said, here's the problem and here's how you might address the problem across these lifestyle factors. So the second point that we had here in the middle, we allowed people to, on a daily basis, answer questions about their lifestyle, just to track what they had actually engaged in. And the third point, we were able to include some metrics or some provision of information over a period of time to show how performance was or wasn't going across these lifestyle areas. So we provided information, we provided the ability to input information, and then we provided some feedback. Quite a simple sort of 3-step process in our system. So our goal was to see, could we really affect behaviour with this app? And if we could affect behaviour and if we could modify lifestyle, then that's going to have a positive effect to avoid the onset of Alzheimer's. So quite a strong hypothesis, but quite a simple underlying process that we tried to do with this phone. So the types of facts and suggestion pairs, they were split across 6 domains. We had 164 of these across food, physical activity, cognitive, social, sleep, and stress. So we had information on each of these areas, and we provide a piece of information to say, okay, this is a problem, and why don't you do this to avoid or to modify your lifestyle. So I should have an example here. Consuming high amounts of processed food is related to cognitive decline. So that was the first piece of information that we delivered. Try a fresh salad for dinner instead of something from a box. So these were randomized and delivered across these 6 different domains. And those 6 different lifestyle domains were associated and have been clinically proven to have an impact on Alzheimer's disease. Okay. So we asked our participants 12 questions every day. Each question related to one of these lifestyle domains. The range was based on WHO or CDC values, and they could set different targets that they wanted to do with regards to sleep, exercise, anything to do with their nutrition. So this is just very, very simple to do. There was a slider, took less than 1 minute, so we spent a lot of time in our design of the app so that it wasn't quite burdensome for the people to use. And then we provided this quite cool feedback across the 6 domains, so people can look very, very quickly and see, okay, for my physical activity I'm doing really well this week, for my diet I'm doing really badly. And this was the element of behaviour change through feedback that we really wanted to instill with our participants. So I'm conscious of time here, I'm just going to skip through to the results that we had. So these are actually the mountains in Utah. I don't know if anybody's been to Utah before, but really, really fascinating place if you do have the chance to visit. So what have we got from the study? We have 122,000 responses logged. So for me, I've been working in this area of health technologies for nearly 20 years. This is the biggest set of data that we have. So it's a huge opportunity for us to understand behaviour, understand how people interact with technology. So I think it was Brian who said about there is a myth that people can't use mobile devices or can't use technology. That's not, and I agree with that. We use it in different ways, and we have a lot of information now to understand how people interact and how we can improve that interaction. So just a few, and I could talk all day really about our results, but this just shows the hour of the day when people interacted with their mobile phone who used this app, and that was quite interesting. So people used it much more at night rather than during the morning or throughout the day. So that's interesting for us to know if we're going to push information out automatically, when is the best time to do it. So the second thing, there's a lot of things on this graph, but this is a measure of BMI, and this is how many times people interacted with our app throughout the week. So here, this is our control group. Here we have people using it once a week, twice a week, and here at the end we have people who used it every day. So the message from this is, people who use the app every day showed the greatest change in their BMI. So that meant they changed their lifestyle and they showed the greatest change in their weight. So that was a positive effect in terms of how we change behaviour. This is quite interesting. We had really, really high compliance with people using the app. So this just shows how many people were using it throughout the weeks of the trial. And then here there was a massive cut-off and everybody stopped using it. And then we went back and we thought, well, what has actually happened? And we told people at this point in time that the study was about to end, and then everybody just kind of stopped using it. So that was an interesting lesson for us as well, that we shouldn't really do that, or we shouldn't have done that so quickly. So just to finish off with some results, and I think this is quite interesting. We had 122,000 logs, as I said, and we saw an increase in intrinsic motivation, and that was statistically significant. We saw a decrease in concerns about memory, and that was statistically significant. We saw an increase in social engagement from using our app, and we saw an increase in HDL cholesterol, which is obviously very important. So we took a lot of biological markers pre and post evaluation in the study. In terms of the influence of technology, we asked people what their views were. 77% felt themselves that this had a positive impact, and 50% liked using the fuel band and said that helped them to promote their physical activity, and 85% said yes, this is the way that I need and the motivation I need to make me more active. So all of this, if we think about what was the question, can we change behaviour with this app? Here we have a lot of evidence to say yes, and we were able to do it. So what's next? This is a key word from a technology point of view, personalisation. Now that we understand how people use it, we need to improve it and personalise it. And that's our job, and that's quite exciting from an innovation point of view. We need to look outside Utah. Utah is quite an interesting demographic because of the Mormon culture there. So they are very, very compliant. And if we use that in a different region, I've used it in Northern Ireland or in a different state in the US, we might find some different results. And we would see that as a limitation, and we have had some comments. And we want to make the app more freely available on the Play Store and for your iPhones as well. So thanks very much. I look forward to maybe speaking to some people at lunch if you have some time. And thanks again for having the opportunity to speak today.